So it sounds like you and Dr. Cha have talked a little about your symptoms today, and it sounds like today she's diagnosed you with depression. So I know you guys talked about what that is and what that means. We're going to send you home with some detailed written information today in case you have more questions on that, okay?
Okay.
So I'm going to talk to you a little about the medication that Dr. Cha has prescribed for you today. So she's going to start you on an antidepressant called Zoloft, and I brought a handout with me. We'll go over it together and then we'll send it home with you today too, okay? So Zoloft is also known by the generic name of sertraline. This is more commonly what you're going to see on your prescription bottle when you fill this at the pharmacy, okay? So Zoloft is used to treat depression, which is usually caused by a chemical imbalance in the brain. So Zoloft is going to help kind of even out that imbalance for you. We want you to take it in the morning, usually at breakfast time. One of the great things about Zoloft is that it's going to help make you a little bit more alert, a little bit more awake during the day. So I know you had mentioned when I checked you in that one of the things that's really bothering you is that you're feeling really sluggish at work. So we're hoping that this is going to help wake you up a little bit. And because you're more awake during the day, we're hoping that it will help you to sleep a little bit better at night as well. We should notice that the Zoloft helps with that overall mood that you were describing to me earlier. I know you said that you just don't really feel like yourself. You feel like sad all the time. So we're hoping that this is going to help bring your mood up a little bit and maybe bring back some of the enjoyment in the hobbies that used to be meaningful to you. Maybe make you want to spend more time with your friends and loved ones again. Okay. The other thing that Zoloft should help with is that we're hoping it's going to help get you on track with a more routine schedule during your day. So I know you mentioned that you feel like you've gained some weight because you've been snacking a lot. Hopefully the Zoloft is going to help you get into a more routine with your meals, and it might help you get back into routine with your activities like going to the gym. I know that really used to be a place of pride, was your gym time. So for now, doctor's going to start you on 25 milligrams. That's a really low dose. We don't want to change doses real drastically with antidepressants. So we'll do 25 milligrams for 1 week, and then we'll do a phone call or a patient portal check-in with you in about a week and see how you're feeling. The plan is to increase your dose to 50 milligrams after that, okay? So like I said, we don't want to change doses real drastically. So if you're noticing any trouble or any problems while you're on the medication, try not to stop it abruptly. Give us a call and let's talk about the dosing, okay?
Okay.
Now, I remember when you started your blood pressure medications last year, you said you were having trouble remember to take them.
Yeah.
So have you figured out a way to kind of help keep yourself on track?
Well, I got one of those pill boxes with the days of the week, so that helps me.
Great. Those can be super helpful. Now, I know you've mentioned in the past to me that you're kind of a tech-savvy guy, right? And you have iPhone, if I remember right?
Yes.
Okay. So I heard about a cool new iPhone app called MediSafe. I've heard great things about it. I've heard that not only does it help remind you when to take your medications, but it's also got an area in the app where you can help track your symptoms. So Dr. Cha wants to see you back in clinic for a follow-up visit in about 2 weeks to see how you're feeling. If you decide to use the app, that might be a great way for us to help kind of keep track of whether the Zoloft is helping and how we might need to adjust your dosing. Next section I do want to touch on is some common side effects that you might notice in the first few weeks of your Zoloft. Keep in mind we expect that these symptoms will go away after the first few weeks, and it can take 2 to 4 weeks for you to start feeling better on your medication. So hang in there, and if you're having trouble, please remember to call us, okay? So the most common thing that we hear from patients is that they sometimes feel a little bit dizzy in the beginning. Some patients also mention that they feel a little bit foggy or cloudy when they're first starting out on the medication. So because of that, probably not a bad idea the first few days that you're taking your medication. Maybe plan that for a weekend, or maybe plan for when you have a couple of days off of work. If you're feeling really dizzy, if you're feeling really foggy or really sluggish, those would not be a good time to get in the car and drive to work, okay? Let's see, other things that you might notice. Again, we plan that these things will probably go away for you. You may notice some stomach upset. So some patients have a little bit of nausea, diarrhea, constipation. We expect that those should go away. Some patients notice a decrease in their appetite. Some patients notice dry mouth. So if these things don't go away for you after a couple of weeks, or if you notice that they're really bothersome for you, give us a call and we can talk about ways to help improve those symptoms for you. Last thing for this section, some men do notice changes in their sex drive or difficulty achieving orgasm. So if you're having any trouble in that department and it's bothersome to you, give us a call and talk to Dr. Cha, okay?
Okay.
Now, there are just a few things that would be big red flags that we really want you to look out for. If these things happen, we would want you to call us right away, okay? The number one thing we would want to hear from you about is going to be if your depressions are getting worse. So some people who start an antidepressant notice that their depression gets worse rather than better. So if you feel like you're having worsening depression, especially if you're having thoughts of self-harm or suicide, please don't wait. We want to hear from you right away. So I'm going to send you home with the card here for the crisis line. Someone mans this phone number 24 hours a day, 7 days a week. So especially if it's during a time when our office is closed and you can't reach us, give this number a call. We're also going to make sure when we give you your visit summary today that our phone number is printed on there, as well as the phone number for our after-hours consulting nurse service. Okay. Other things we would want to hear from you about, rarely, but once in a while, some people notice a skin condition that can cause really bad rash, blisters, or peeling. Some medications and supplements can interact with your Zoloft. So before you would start any new vitamins or prescriptions from other doctors' offices, we want you to give us a call so we can make sure that there's no interactions. And let us know if you have any unusual bleeding or bruising or any vision changes. Okay? So like I said, we want to see you in 2 weeks. And when I walk you out, we'll stop at the reception desk so you can make that appointment. Now, I know that's a lot of information, and I want to make sure that I did a good job of teaching and explaining everything and I didn't miss anything. So in your own words, can you tell me how you're going to take your Zoloft?
Well, I'm going to take the Zoloft in the morning around breakfast, and I'll use an app.
Sure. If it works for you. If it doesn't work for you, you're not stuck with that. If you find a way that works for you, that's totally fine.
Okay.
And what things are you going to be looking out for or going to call us for?
Worsening depression.
Yeah.
Thoughts of hurting myself.
Good. That's the number one thing we want to hear about. And if you are having these thoughts, say late in the evening or on a weekend, something like that, who are you going to reach out to?
When you call the crisis line on this card here.
Great. Wonderful. Are there any other questions that you have for me or anything that I didn't touch on or something that you need clarification on?
No, I can't think of anything right now.
Okay. If you think of anything later, like I said, we're sending the handouts home with you. You can reach out through the patient portal at any time. You can give us a call as well. Okay?
Okay.
All right. Let me make sure Dr. Cha was completely done with you. I'll get your visit summary, make sure we have all your patient handouts, and we'll get your follow-up appointment scheduled.
Okay. Thank you very much.